COVID-19 pandemic has taken a psychological toll on everybody. Millions of people are fighting in this battle, especially the healthcare workers, the doctors, janitors, domestic workers, and nurses. It has always been a war zone in the medical field during this pandemic. Lives are being taken, several people are being admitted every day, and everything's just exhausting as days go by. Amidst this pandemic, nurses feel like their safety isn't guaranteed anymore. This is due to the fact that the number of patients have been increasing, and the quality of face masks, PPE, and gloves to protect the nurses from the virus are not enough. Anxiety symptoms increase over time, as well as their fear to be infected and infect others. The COVID-19 outbreak has had an immediate impact on the nurses' mental health, which demonstrated a time effect on the nurses' depression, anxiety, PTSD, and sleep disturbance. We need to know that mental health is as important as physical health. Mental health affects how we feel, think, and act.
Nurses work an average of 100 hours per week. Needless to say, every second and every hour that they spend inside the hospital, there is a risk that their lives will be compromised. This causes enormous stress and anxiety to these healthcare workers who constantly worry for their and their family's safety. The project Behind the Mask aims to determine the impact of the pandemic to the mental health of healthcare workers such as nurses. Our goal is to shine light on the issues that nurses come across with during their battle as a frontliner against the COVID-19 virus. We need to realize that nurses are human beings too, and that they are also vulnerable to stress and other mental health issues as well. Through this project, we will be able to address and fulfill the basic needs of nurses, which includes offering psychological guidance and support. This project would consist of professionals such as psychologists who would offer their guidance to our nurses to help assess their current mental state and whether or not they would need assistance with their mental health issues. The cooperation of health centers, hospitals, and clinics would be vital in this operation, considering that they would be the ones who would have direct contact and interaction with the project. Help us make our project possible and ensure that our frontliners will be able to get the assistance and help that they need, especially during these dark times. We must join our hands to defeat our common enemy, and we can do this by supporting our cause. It is now time for us to take care of our healthcare workers just as how they would take care of us when we are sick.